Welcome to Maryland Medicine Frontline News. Coming up, researchers investigate the effects of COVID-19 on the brain, including cognitive problems and serious psychiatric disorders. But first, a survivor's story. Having just recovered from lung cancer surgery, Lou Packett called 911 when he woke up with fever and exhaustion on March 31st.
They strapped me in the ambulance and asked me if the seatbelt was comfortable, and that was the last thing I remember for the next 23 days.
Lou was in a COVID unit at the University of Maryland Medical Center.
That afternoon, I was put on a ventilator and they induced a coma. And I was on the ventilator for 3 weeks. When it attacks you the way it attacked me, it's no joke. It attacked my lungs, which most severely, and which I'm fighting to this day, and could well be fighting for a lot of years. I don't know. Nobody knows. Nobody knows the answer to that question. But it also attacked my heart. I went into atrial fibrillation. And so I'm on medication for that.
And there were some cognitive effects as well.
I'm still told by 3 of my doctors that I am the sickest person that has survived the coronavirus that they're aware of at the University of Maryland Medical System.
Surviving COVID took a tremendous toll on his body.
When I left the hospital, my cell phone felt heavy to me. I had lost 25 pounds. I only weighed 150 when I went in. My muscle mass was gone.
Lou was one of the first COVID patients to receive comprehensive inpatient COVID rehab at the University of Maryland Rehabilitation and Orthopedic Institute.
I had one therapist who worked on my cognitive and my speech and my swallowing. Then I had a physical therapist and an occupational therapist.
Here in an acute inpatient rehabilitation facility like UM Rehab, it is our mission that every patient gets 3 hours of intensive rehabilitation per day. And in some cases, it's that type of intensive rehab that helps people get home quicker.
But the long-term effects for COVID patients are unknown.
I think the most important thing is, as a state, that we recognize, and as a nation, that we recognize that COVID is likely to be with us for a while, and that more and more science is pointing to the fact that it does have long-term consequences, even in patients who have mild disease.
There is increasing evidence that the coronavirus can cause cognitive impairment and trigger serious psychiatric disorders. Writing in the Journal of the American Medical Association, Dr. Theodore Postolaki says the biological mechanisms may include direct neuroinvasion and triggering of immune activation in the brain.
The coronaviruses have proven that they invade the brain. So it's not like that they would elevate an immune response that may affect the brain, but they're actually capable to reach brain tissue from, at that time, the thinking was from the nasal pathways, and so affect brain centers involved in mood and behavioral regulation and dysregulation. In terms of the non-specific symptoms, those include elements of fatigue, sleep and wake abnormalities, contributing to somehow a sense of not reaching your level of performance that you're accustomed with. We would expect that approximately 1/3 to 3/4 of individuals with COVID-19 severe enough to have someone admitted to a hospital would end up having depression or PTSD or anxiety disorders, any infections that lead to hospitalizations tend to increase the risk of suicide, and that risk of suicide is actually increased more 1 year after infection than it is immediately after infections.
And what I think is exciting is he's beginning to understand the biology between these intersections and also the potential role that certain therapeutic intervention might have on averting these suicidal thoughts. I think that is rather exciting because, again, it is something that we now are seeing in patients with COVID-19, having had it and now continue to linger for some time. So to the extent that our own faculty are working in this area gives me great hope and great confidence that they indeed will find something that could become a therapeutic or, in fact, a prophylactic agent in the future.
You can stay up to date by visiting the Coronavirus Update page on the School of Medicine website. Until next week, I'm Larry Roberts for the University of Maryland School of Medicine.